Hello everyone, we are from Group 15 and we will be presenting about comorbidity of ectopic Thymoma-Associated Exfoliative Dermatitis and Pemphigus foliaceus in a cat. To start, exfoliative dermatitis and Pemphigus foliaceus are traditionally viewed as entirely separate clinical challenges. So what is the difference between them? Exfoliative dermatitis is a well-known skin syndrome typically linked to thymic tumors in cats, while Pemphigus foliaceus is an autoimmune blistering skin disease that is considered idiopathic in nearly all feline cases. However, there is a rare clinical intersection reveals that these two severe conditions can manifest concurrently in a single feline patient. The driver behind this unique comorbidity is a thymoma. So below is the mechanism of how thymoma affect immune system. So because thymic tumors can be ectopic, which located outside of chest cavity, standard thoracic radiograph can completely miss them. Complex or overlapping autoimmune skin diseases demand thorough physical exams and advanced imaging such as CT scan or MRI to catch hidden ectopic thymic masses. Moving on to the patient's signalement and history. So the patient was an 8-year-old castrated male domestic short-haired cat. The history was the patient had a 1-month history of progressive skin lesions and severe pruritus that have proved unresponsive to prior antibiotic courses and anti-inflammatory doses of glucocorticoids. According to the owner, the cat maintained a normal appetite but was visibly uncomfortable due to the intensity of the itching and development of the skin lesion. During the presentation, the cat was heavily medicated with a comprehensive drug regimen consisting of prednisolone, cefpodoxime, buprenorphine, and gabapentin suspension.
For the first promise is generalized exfoliative and crusting dermatitis with alopecia. For the differential diagnosis, first is either infectious, which would be dermatophytosis. Second is parasitic due to notohydrous cati, even or demodicosis. Third is allergic due to ectopic dermatitis or food hypersensitivity, and fourth is either due to immune mediated. For the second promise is purulent parenchyma affecting multiple digits, could be due to Pemphigus foliaceus or even deep fungal infection. And for the last promise is pruritus. The differential diagnosis, allergic or hypersensitivity, is due to ectopic dermatitis or food hypersensitivity. Second is parasitic due to notorious cati, flea allergy dermatitis. And last is immune mediated, which would be due to Pemphigus foliaceus or even exfoliative dermatitis.
Moving on to the physical examinations, upon clinical presentation, the patient exhibits several distinct dermatological lesions, primarily characterized by alopecia, scalding, and also severe crusting. So for the ear, both convex pinna show noticeable alopecia with scalding and crusting that extend down into the concave aspect. For the extremities, all 4 feet were affected by mild foot pad exfoliations and crusting. Other than ear and also extremities, he observed distinct crusted lesions along the nasal bridge, as well as a minor ulceration right at the lip commissure. At the body and trunk, large silver scales and multifocal crusted were prominent across the preauricular regions, the neck, and also the trunks. There were also highly concentrated, several crusting around the nipples. Cytological examination also have been done in this case. Impression smear obtained from the skin after removing the pinna crusted reveal neutrophils and also lymphocyte without any presence of bacteria. And for the impression smear from the foot pad show only corneocyte. Cytological examinations of purulent exudate collected with swab from the nail bed reveal cocci, branching root, neutrophil, and also a acantholytic cell, and sample from the nail bed was therefore submitted for aerobic bacterial culture. However, no microbial growth was isolated on the culture. We continue with another diagnostic investigation that has been done in this case by looking at the histology result. In the left picture, we can see mild lymphohistocystic interface dermatitis with basal cell populations and also apoptosis along the junctions between the dermis and epidermis. The second picture shows an intraepidermal pustule containing non-degenerated neutrophil and acantholytic cell. After the owner decided to euthanize this cat, a postmortem was done, revealing the presence of fusiform, soft, homogeneous tan to pink mass at the ventral aspect of the cervical fascia. To confirm the autoimmune nature of this case, direct immunofluorescence was performed. The result were conclusive to show linear IgG depositions along the basement membrane zone, paired with a superbacillus web-like anti-keratinocyte IgG pattern.
Following our diagnostic workup, we arrive at a definitive diagnosis. First, postmortem findings reveal an ectopic thymoma. While thymomas usually sit down in the chest cavity, this one developed in abnormal location in the neck, specifically along the ventral aspect of the cervical fascia. Because of this ectopic location, the tumor was completely out of frame and missed on the initial thoracic radiograph. What makes this case truly remarkable is the comorbidity. Exfoliative dermatitis and Pemphigus foliacus are well known, but feline Pemphigus foliacus is almost always considered idiopathic, meaning it happens without a clear cause. Finding both diseases simultaneously is highly unusual, but finding them linked to a thymoma is such a rare case. So let's us move on to the patient clinical outcome. 1. Deterioration. To ensure the skin biopsies provided accurate results, the cat prednisolone was discontinued. Without the steroid acting as immunosuppressive shield, the underlying thymoma drove a massive autoimmune flare-up. Consequently, the skin lesion and intense itching worsened rapidly prior to the procedure. Secondly, acute complication. Following this, a severe unexpected complication occurred. The day after the biopsy's anesthesia, the patient developed severe anorexia, azotemia, and anuria. Essentially, this is a sudden kidney failure. Because this happened so pre-acutely, post-mortem examination didn't even show physical cellular damage in the kidney. Third point is the resolution. The veterinary team aggressively tried to restart urine production with intensive intravenous fluid, but the anuria persisted. Facing this sudden severe renal complication, on top of an already painful skin condition, the owner made the difficult decision to elect euthanasia rather than pursuing dialysis.
Let's move on to the clinical interpretation. So for the primary diagnosis, there is comorbidity of both ectopic thymoma-associated exfoliative dermatitis and also the pemphigus foliaceus. For pathophysiology, thymoma disrupts central tolerance, which frequently triggers secondary autoimmune or immune-mediated diseases. Identification of an underlying thymoma is critical because surgical removal can lead to long-term remission of the autoimmune disease. Finally, for the diagnostic takeaway, standard lateral radiographs can easily miss a thymoma if it is small or located outside the thoracic cavity. Advanced imaging like CT scan and MRI should be pursued.
As for the conclusion or key take-home messages, first and foremost is that thymoma can be associated with multiple autoimmune skin diseases. Next, pemphigus foliaceus and exfoliative dermatitis may occur simultaneously. Negative thoracic radiographs do not exclude thymoma. Ectopic thymomas may require advanced imaging modalities such as CT scan or MRI for detection. Histopathology and immunofluorescence are essential for definitive diagnosis. Lastly, thorough investigation is warranted in cats presenting with exfoliative dermatitis and pemphigus foliaceus.